Welcome. In this lecture we shall consider the topic of survival analysis. In this lecture we introduce survival analysis, which is a set of statistical methods for analyzing time to event data. Survival analysis is commonly used in medical research, especially with cohort studies and clinical trials. We shall highlight the critical issue of censoring, where the event of interest is not observed for all subjects. In this presentation, we also distinguish between non-parametric approaches, such as the Kaplan-Meier method, and then the semi-parametric approach, which uses Cox regression, and then some other parametric approaches. The key concepts we shall cover will include the survival function, the hazard function, the log rank test for comparing survival curves. This lecture will emphasize that survival analysis is superior to simpler methods because it properly handles censored observations and the time component of the outcome. We shall look at what survival analysis is. We shall consider the terminology and data structure. We shall look at survival and hazard functions. We shall look at parametric versus semi-parametric regression techniques. And we shall introduce the Kaplan-Meier non-parametric method. Survival analysis consists of statistical methods for analyzing longitudinal data on the occurrence of events. And the events that we may be interested in may include death, injury, onset of illness, recovery from illness, and all these are binary variables. Or it could be transition above or below the clinical threshold for a meaningful continuous variable, such as, for example, the CD4 count. Survival analysis accommodates data from randomized clinical trial or cohort study design. Recall a cohort study design, wherein we take a sample from a reference population and we follow them through time, beginning at a baseline where we measure those who have the risk factor and find out those who have and those who do not have, and then we follow them through time to see those who develop the outcome and those who do not develop the outcome. We should also recall the randomized clinical trial. So from the reference population, a sample is selected and randomize them to groups to either receive the intervention or no intervention, and then just like in the cohort study, we follow them through time, and in this case we see who develops the outcome and who does not develop the outcome and compare the two groups. So examples of survival analysis in medicine. So we've come across plots like this, and this example is from a published biomedical journal, JAMA, Journal of the American Medical Association, and so we see this Kaplan-Meier estimates of cumulative hazards of selected clinical outcomes, and this is comparing two groups, one group on estrogen plus progestin, another group on placebo, and basically comparing outcomes, coronary heart disease and stroke, and then we can see here is the hazard ratio, the confidence intervals, and so on. And so these curves just basically shows how the two groups compare in terms of the events that they are looking at, coronary heart disease and stroke. So we've come across this in different studies, and so it encompasses a wide variety of analytical methods for assessing time to event. We've already stated that, and the prototypical event is death, hence the name survival analysis, but other events too can be analyzed. So it estimates the effects of one or more factors on survival of a cohort of disease specific patients. So special methods are needed because time to event is not normally distributed. It has other names, sometimes known as event history analysis, failure time analysis, transition analysis, duration analysis, and reliability analysis. But in our own field of biomedical research, we call it survival analysis. So in survival analysis, we aim to estimate time to event for a group of individuals. So for example, time until a second heart attack for a group of MI patients. We also use it to compare time to event between two or more groups. So we can compare different groups. So a treatment group versus a placebo group in an RCT. We also can use it to assess the relationship of covariables to time to event. So for example, does weight, insulin resistance, or cholesterol influence survival time of myocardial infarction patients? So why do we use survival analysis? So why not just compare the mean time to event between our groups using a t-test or a linear regression? The reason with this approach is that it ignores censoring. What is censoring? Well, you hear more about that as we go on. But this first approach, wherein we compare the mean time to events between groups, ignores censoring. A second approach that could be tried will be perhaps to compare the proportion of events that using risk or odds ratios or logistic regression. This is an approach that is often used, commonly used, but the drawback with this is that it ignores time. It ignores time. And so these two approaches would give biased estimates because they ignore censoring and they ignore time. Survival analysis is done, the study design is essentially an open cohort study with person time assessment. But in this instance, there are two major differences. Unlike in the open cohort study, in survival analysis, there are two major differences. So the first is that time to event is measured for each subject. So we're as opposed to events per time interval. So in the open cohort study, we're looking at the incidence rate. So the denominator is the exposure time, right? And so we're looking at the number of events in the population at risk per exposure time. So that's what we do in an open cohort study. But in a survival analysis, what we are now measuring is time to event, not events per time interval. And the outcome event is usually more frequent. So for example, it assumes that the outcome event will occur sooner or later in a large proportion of the subject. So the underlying assumption is that given enough time or given a long enough time, all of the population or almost all of the population is going to experience that outcome event. So for example, death is an event that everybody is going to experience sooner or later. And so this is the key thing about survival analysis that makes it different from the other types of analysis that we're used to. So time to event is measured and the outcome event is more frequent, with the assumption that sooner or later all of the population is going to experience the event. It takes into consideration that these survival times are not normally distributed, rarely normally distributed, and so it should be estimated non-parametrically. It also considers time-dependent covariates, and it involves what we know as censoring. The most often used methods that we use for survival analysis are Kaplan-Meier estimates and plots. So that example that we showed from JAMA uses Kaplan-Meier estimates and plots. And then the log rank test, which is a statistical technique to compare differences in survival times. And then we have the Cox regression, which is a special formulation of regression analysis that we use for time to event data. So we'll look at some terms. You've heard us use the time to event, you've heard us use censoring. So time to event is the time from entry into a study until the subject has a particular outcome. Subjects are said to be censored if they are lost to follow-up or drop out of the study, or if the study ends before the event of interest is seen. It could be mortality, or it could just be any outcome of interest. So they are counted as alive or disease-free for the duration in which they have been enrolled in the study. So from beginning of the study to the end of the study, they did not experience the event, so they are censored. So if they are lost out, they are censored. So what censoring simply means is we did not observe the event, either because the participant has dropped out of the study, has been lost to follow-up, or the study ends. So censoring just means we did not observe the event. And then the data structure, unlike previously that we've been looking at data that has just one outcome, one variable outcome. In survival analysis, there is a two variable outcome structure. And what is this variable? What is this outcome variable? This two variable outcome that we're looking at. We're looking at the time variable. So time as at the last disease-free observation or time of event. So that's what the time variable is. It's either the time the event occurred or the time that we last observed the subject if the event did not occur. So that could be the last time the person was in the study, the last time before the person dropped out, or the end of the study, right? So it's either time at last disease-free observation or time of event. Then we have what is called the censoring variable, which is just simply an indicator of whether the event occurred or the event did not occur as at the time that we are observing. So 1 if the event occurred, or 0 if there was no event by time t. So this is a two variable outcome structure for survival analysis. So we have the time variable and we have the censoring variable. Again, censoring is when the study subject is not under observation. And because time is followed very closely, censoring is a critically important feature in survival analysis. So, and there are different types of censoring. So we have right censoring. This is the more common one that we know about. This occurs when a subject is removed from the study before the outcome event occurs, and there's different variations. So a patient has not yet experienced the outcome by the end of the study, the patient is lost to follow-up before the study ends, or the patient experiences a different event that makes further follow-up impossible or removes the patient from the risk of the main outcome. So it's either death or some other competing risk. So basically the person is removed from observation before we observe the outcome event in the person. And then we have left censoring. Left censoring means that the initial time of the risk is unknown. So we don't know how long the person has been at risk. And so that's left censoring. In a way, we can say that all studies are left censored because we really cannot tell how long the person has been at risk, right? But of course there are some studies that we can know. I mean, if you are doing an interventional study, the risk or the exposure is now the treatment, so for that there is no left censoring. But if it was just simply looking at some groups and following people through time, then we can say there is some form of left censoring. Then we have interval censoring. So subjects come into the study and then they go out of the study. So this can be seen, interval censoring. And then survival distributions. Remember we said that the time to event is not normally distributed. However, it does follow a probability distribution, and it is a random variable, and so it's defined as Ti. The event time for an individual is a random variable having a probability distribution. And there are different models for survival data distinguished by different choices for the distribution of T. So for example, we may consider using a Weibull distribution, for example. So that's one distribution that is commonly used in survival analysis. So we need to look at the concept of survival and hazard. survival function or probability is represented by the letter ST. So the survival function is the probability that an individual survives from the time of origin, that is diagnosis, to a specified future time t. And this probability incorporates a certain period of time. The hazard function or rate is the instantaneous event rate for an individual who has already survived to time t. So given that the individual has survived to time t, what would be the event rate at that time t? That is what is known as the hazard function, represented by ht. So ht is given to us as the negative derivative of the natural log of the survival function. Okay, so we have the Kaplan-Meier or the product limit method, and this is the cumulative incidence after case occurrences. So remember, so here risk is given to us as 1 minus the probability of surviving in the first time period multiplied by the probability of surviving the second time period. And so we end up with this as we see here, 1 minus 0.8, and so that 0.8 represents the probability of surviving over 2 years. So let me break it down. So assuming we have some subjects and we observe them over 2 time periods, and the probability of the event occurring in each time period is given to us as 0.1. So in the first time period, the probability of surviving that first time period is given to us as 10 minus 1 divided by 10. At the end of the first time period, we have 9 people left. Probability has not changed. It's still 0.1. So we're going to have this over this, and so this gives us so this times this, and we end up with 0.8, and this is the probability of surviving the 2 time periods. So risk is estimated for the follow-up time corresponding to each new case occurrence, and so this is basically what we call the Kaplan-Meier method of risk estimation, and it's the basis for survival analysis. So we take the period of follow-up, and they're broken up into time intervals, and what we look at is the probability of surviving each of those time intervals, and it's considered that these probabilities are independent, and so which is why we multiply them. So the probability of surviving this second time interval is independent of the probability of surviving this first time interval. So this is the assumption that underlies it, so that's why we multiply. So here you have, so the survival function is defined as the probability of surviving at least to time t. The graph against time is called the survival curve and is estimated by the Kaplan-Meier method from observed survival times without the assumption of an underlying probability distribution. So it's non-parametric. There is no assumption of an underlying probability distribution. And so these are the equations. So survival is basically the complement of risk, and risk is the complement of survival. That's really what it is. So let's look at an example. So assuming we have this data, so we have patient 1 to 15, and the survival time is given in days, 1, 1, 4, 5, up to the 72nd day, and then the outcome we have is death, right? So, and the treatment, so there are 2 treatment groups coded as 1 and 2. So we look at this. So the Kaplan-Meier method takes into consideration censoring, loss to follow-up, or competing risk. So for example, observation number 5 here is censored because person was in the study up to 6 days and we don't know what happened, probably dropped out. So we don't know whether the person died or survived. So this is an example of a censored observation. Likewise for observation number 10, right? And then even this one, observation number 7, is also censored because we did not observe the event, right? So this person survived, this person survived, this person survived. So survived, unknown, unknown. All these are censored observations. And then this is the corresponding time to event. Okay, so risk is estimated as 1 minus survival for the follow-up time corresponding to each new case occurrence. That is time to event. So for example, let's look at it. On day 1, survival at 1 day. So on day 1 we had all 15 patients present, isn't it? And then one patient died. So this patient number 1 died on day 1. So survival at day 1, or rather day 2, because we had patient 1 and 2 dying, so 2 patients died on the first day. So survival at day 1 is 15, the total number of patients, minus 2 patients who died on day 1, because it's survival time day 1. So you have 15 minus 2 divided by the total number of people at the beginning of that survival period. So 15 minus 2 divided by 15 gives us 0.867. The next time period here is day 4. Right? On day 4, we have at the beginning of day 4 13 subjects, because remember 2 have died, and so at the beginning of day 4 we had 13 subjects, and then one of these people died. Right? So you have 13 that you began with minus the one that died divided by the 13. So survival at day 4 is given to us as 0.80, and so similarly you can do that all the way to day 37. By day 37 we had just 3 people surviving at the beginning of day 37, and of that 3 people, 1 person died, and so the probability of survival at 37 days is 0.2682. So this is how the survival is calculated for each time period in consideration. So here's the full table. So look at this. So beginning we had 15 people. So on this day 1 died. So this is the survival function. So this is calculated for each time interval, and so you can see this is the survival function as it changes over time in the study, right? And so this is just giving us for each time period how many people are being lost. So net loss is 0 here because we know the outcomes, but here there's 1 person lost because it's censored. It did not die but left the study, so 1 person lost, and so that's really what you're seeing here. So the log rank test is the most widely used method for comparing 2 or more survival curves, and it tests for the equality of survival distributions. The cost regression model is given to us in this form. You can see again it takes the same form as our regression equation. So you have here H0 plus BX. However, the outcome here is what is known as the log of the hazard. This is the hazard function, and this is the natural logarithm. So we can use regression methods to investigate the effect of several variables upon the time a specified event takes to happen. And this is useful in studies with unequal periods of close observation and binary outcome. So open cohort studies or survival analysis. And this provides stable coefficient estimates with decreasing variance estimates for increasing periods. What are the assumptions in the Cox regression? The assumption is that outcome events occur independently. Hazard rates may vary over time, but the multiplicative effects of exposure variables, the hazard rate ratios, are constant over the entire period of observation. So censoring of subjects should not be related to the probability of an event occurring. So this is a brief introduction into survival analysis, which itself is a whole advanced topic, but it's important for us to understand these concepts so that it's easier for us to understand studies that we come across that have used this method of analysis. We shall treat more of this during our practical sessions.